A state plan is really so useful as an administrator because it's your blueprint for what you're planning to do. It's your opportunity to have really vetted your thinking with a number of different partners and stakeholders. So it's an opportunity to really sit down and say, what are the issues we're facing in our state? What are the trends that we need to be aware of? What are the resources that we currently have? And what direction is everyone going? And that state plan becomes your blueprint for not just you as the FIPS administrator, but ideally everybody who's working on family violence and domestic violence in your state to really be on the same page and moving in the same direction.
A state plan is actually designed to give the mission, the values, and the goals and objectives of whatever it is that you're working with.
A state plan for FIPSPA involves getting community partners together, reviewing the programs and projects that are ongoing in the state, thinking through what you might want to add as far as services or activities. We meet with our state coalition. We meet with other community partners. We also involve some of the funded programs so we can do the best possible in implementing strategies and activities that they think would be most helpful in our state.
We began developing our state plan in North Carolina simply by calling some of our internal partners to the table. We have people who represent child welfare, we have people who represent adoption and foster care, and we actually have called some of those individuals to the table to let us know what are some of the target areas in North Carolina that demand our attention. Where is it actually that domestic violence may actually be an issue? What are some of those areas? So we've actually called in external partners for that.
To ensure funding for underserved populations, we review local community needs assessments. Most areas in the state of Alaska are considered rural. We have a large immigrant population in the state. We also have a special project in our state looking at people with disabilities and how they can access service of domestic violence programs.
I'll tell you, it's really difficult to think about emerging needs when you're in a fiscal crisis like we are and you're trying to balance those with core services. We've really tried to focus on, within the current programs that we have, how do we allocate additional monies, if at all available, and or restructure the way that we allocate monies to address those emerging needs within the context of what we currently fund.
We use our state plan as an opportunity to meet with others, so we do bring other key disciplines and stakeholders at the state level as well as the local level to the table as we think about what the state plan will look like. We actually in Michigan have a 7-person governor-appointed board that ultimately finalizes the state plan and is responsible in that manner. But it's really an opportunity to do as much outreach as possible and try to involve as many people. One of the areas we've put a lot of emphasis on in recent years, because frankly we hadn't done the best job with that in past years, is we're trying to look at non-traditional audiences that we hadn't done a very good job of addressing. We had many more mainstream organizations and mainstream disciplines that we were working with and really weren't reaching out to some very wonderful community-based groups who might be doing more specialty audiences. And so we've done a lot more active work and help and actually brought in some national consultants to help us look at how we can do that better.
We have partnered and collaborated together to develop a state plan that identifies multiple areas of priorities that we believe will enhance the quality of life for those victims, not just as they get immediate services, but also to assist them as they move forward from victim to survivor. So I believe that the development of our state plan that takes into consideration multiple priorities, some that are based on FIPS's mandate, but others that are based on what we know about our local communities doing the work in Maryland. I think that tandem will ensure that our future as we do this work is bright and that needs are met and that gaps, strategic gaps that in the past we have been unable to address, we'll be able to successfully address them as we move forward.